Good morning. You are welcome to a health guide. My name still remains Dr. Isa Abdul Mujib, and today we are looking at travel health. Today we are looking at diabetes. So this is specific risk condition. You are diabetic and you're going to travel. What are your precautionary measures you need to put in place? So it is not a death sentence to be diabetic. So many people have diabetes and they travel all over the borders, all over the world. But a lot of developing countries, when they travel, they are very, very unconcerned about what they need to do. And we have lost a number of Nigerians that travel outside the shore of Nigeria, and then they have complications right away in the aircraft or as they landed because they do not know what to do. So when you travel exposes you to a lot of foods. Now you are used to what you eat at home, you are so controlled, you have a way of managing it. In that regard, you're going to be exposed to some meal that's unusual to you. So you must understand what those meal contains and what is the content of those meal. You may need to ask, otherwise you take a little of it so that you get yourself balanced. Beyond that, your meal can be delayed sometimes. In case your food is delayed because you're in another country, it may be they prepared one something for you that you know you cannot eat it, and you're asking them to do rice for you, and it's going to take another time again. So you may need to take something before then. You can take some nuts, you can take some crackers, you can even take some sugar cube, but before the food that's prepared is ready. So that's very important for diabetic patients. Again, when you travel, for a diabetic person, you may need to travel with a companion. If you're traveling with a companion, that your companion must be fully informed about what are the symptoms of hypoglycemia. Hypoglycemia means that when the blood sugar in your body is too low, what are those signs that can be shown? And so your companion must know. For example, you feel dizzy, your eyes is now blinking, you feel tired, and you're sweating right away from your forehead to your chest, and that means that you're becoming hypoglycemic. And I can warn you, it kills faster than hyperglycemia. Hyperglycemia is when your blood sugar is rising beyond normal, but hypo is when it is extremely too low. People die easily on account of that. Number 3 is that when you're traveling as a diabetic patient, you must be well equipped with your materials of testing. So you have your glucometer and your strip. Don't go with a glucometer alone. You might not find the strip over there. So go with a glucometer with a strip, and enough strip that's going to be enough okay for you while you're traveling. So you can even need to check your blood sugar while you're traveling. Sometimes people collapse in aircraft and they say they have hypoglycemia. That means the amount of sugar in their body is too low. You can use your glucometer to check right away, and that's going to assist you. And beyond this, you also need to carry insulin. Insulin is a kind of a chemical that's used for diabetic patients. They inject themselves or they are being injected. You need to carry it with original label and then with a prescription of a medical doctor, and keep in a cold pack and carry it. Nobody will stop from carrying it across the border. Beyond that, as you are diabetic, one of the things you must also do is to have a bracelet in your hand or a tag that will show that you are diabetic. You see, this happens a lot in developed countries, whereby a driver who is diabetic suddenly collapses on steering. An ordinary policeman who is well informed is going to take care of that person, because he will check his hand or his neck and see, oh, I am diabetic, and that's enough to save the person. In case that happens to you, you need to be very careful. So if you are going with medication, drugs, please go with enough drug that is more than the number of days you're going to spend. You are going for 2 weeks, go with drug of 1 month, because what if anything happens and you're delayed or there's other changes in your flight schedule? So you might need to take your drug very well. So on account of this, diabetic traveling must be very, very careful. They run into trouble of what they eat and how to survive in another country. Until we come your way again, you can reach us on 0802 3311 868. Thank you for listening.